Welcome back to STL Live. I'm Sarah Bernard, and today we're learning about opiate and heroin issues, and with my guests, Craig Schmid and Nile Garba of the Department of Health from the City of St. Louis. Welcome back. So we've been talking, Nila's been filling us in on the really grave statistics. We all know that heroin is a big topic in the news right now. Craig, in the last segment you mentioned that we are the only state of the 50 states that does not have a prescription monitoring program.
That's correct.
But that is changing next month, or in 2 months, April.
Yes, April 25th we will go live. So because the state of Missouri has not taken this up, St. Louis County began a prescription drug monitoring program. The city of St. Louis quickly joined them in November this past year so that we can go live in April. Mm-hmm. It will give us a lot of information. It will give information to CVS and Walgreens and all of our other pharmacists so that hopefully they will know if somebody is trying to pharmacy shop or prescription shop.
So what effect might this have, do you think, on St. Louis?
Well, what it's had in other locations is it stops people from doing the prescription drug shopping, and it reduces deaths. Mm-hmm. It also helps with regard to the prevention aspect, which is so very important in this area.
And do you think there is an opportunity for people to recognize the need for treatment? Their issues may be identified more closely or quickly by their doctors.
Well, we'll have the data, of course, but I don't know if directly that will have that, but there may be an educational piece that we also have with that. But there are other pieces to this entire puzzle that need to go together. So the other part is the intervention piece. So Narcan, it doesn't provide treatment, but what it does is it revives individuals. So as Nila indicated, it suppresses breathing, respiration, and so if somebody
the drug use
does,
mm-hmm.
and so Narcan can help bring somebody out of that. So our emergency medical personnel in the city of St. Louis have that. This past year, they revived 1,900 people.
So the ambulance drivers specifically, is that right?
That's right.
And the emergency rooms?
They have that as well.
Okay.
Right? And the year before it was 1,200. All of St. Louis County police officers have it in their car. The city of St. Louis will be beginning a pilot project. We are beginning that with, I believe, 25 officers in the South Patrol Division of the City of St. Louis for the Metropolitan Police Department.
Do you have any idea how much time, when somebody is experiencing an overdose, how much time do we have to get that Narcan into their system? Do you know?
I personally don't know how long it takes, but obviously the quicker the better. And it to some degree it'll depend on how much is in their system. It'll depend on the combination of drugs. I think a lot of that matters. And so sometimes by the way, Narcan isn't just dispensed by individuals such as that. So you and I can go to the pharmacy now. If they have a protocol from a physician, you can purchase it there without a prescription. So if you have relatives or you know somebody who has that, you can administer it. It can be done by a spray, nasal spray, and we can all save a life that way.
So that's available now?
It is available now, as of August of this past year when the legislature approved that.
Okay, well we definitely need to get the word out about that.
And we have the Good Samaritan law, which values life over arrest, so we can't arrest our way out of this. And in many instances, people are engaged in illegal activity and they may abandon the person who is dying essentially from an overdose, or they may throw them into a hospital and just leave them there and there's not quick enough treatment. So the Good Samaritan law says if you call 911, you're not going to be arrested. So that's another good piece of that.
Okay, and that applies to anybody? So,
anybody.
Okay.
Correct.
So, because I've even heard high school students talk about that.
Good, the message is out.
Yeah,
if
absolutely.
high school students know it, like my children, other children, the word will get out.
Yeah, very good. Okay, so what else, Nila, are we facing here in this with regard to substance abuse and addiction?
Well, there's also been an increase in the use of fentanyl, and that's nationally, and the city of St. Louis is also experiencing an increase in that as well, and that is 50 times more potent than morphine, so it's an incredibly dangerous drug, and a lot of the times people who are using heroin, sometimes that drug is mixed together with the heroin, and they don't know that they're using fentanyl, and just a very small amount of that can be lethal. So we are seeing an increase in fentanyl use, and When substances are mixed together and they're used, or if they're using heroin with alcohol, that can be a really dangerous combination that could cause overdose or death.
Yeah, all right. So be careful, get help, get treatment. There's more STL Live after this. Stay with us.